Guidelines for the operation of disposably ranged catheters. Scope of application. It is used clinically for the drainage of air, fluid and pus accumulation in the thoracic and abdominal cavities. Applicable department: Emergency Department, Interventional Department, Hepatobiliary Department, Oncology Department, Cardiothoracic Surgery Department, ICU. Pigtail with nylon thread. Pigtail with a nylon thread. Straight with nylon thread. Straight with a nylon thread. The structural composition of the drainage catheter. Drainage catheter: inner core needle, outer needle tube. Product features of the drainage catheter. The catheter body is made of medical-grade polyurethane (TPU) material, which has good biocompatibility. This product can be used to establish a drainage path by one-step puncture or Seldinger puncture. The pigtail-shaped curled end prevents damage to the visceral wall and prevents the pigtail-shaped end from detaching from the patient's drainage site. The wired catheter is equipped with a convenient and reliable safety clip, which enables the catheter to be firmly fixed at the drainage site. The scale markings on the catheter are clear and can be visualized under Extra, making it easy to determine the position of the catheter. The front end of the catheter has multiple elliptical drainage holes, which greatly enhances the drainage capacity. Common puncture methods for drainage catheters. One-step puncture method. 1. Push the straight pipe to the tip of the conduit to straighten the pig's tail. 2. Straighten the nylon thread. 3. Connect the outer needle tube to the catheter. 4. Remove the straight pipe. 5. Remove the cardstock between the outer needle tube and the inner core needle. 6. Unlock the inner core needle. 7. After puncturing to the drainage site, unlock and remove the core needle. 8. Unlock the external syringe and push the catheter. 9. Pull the nylon thread to make the front end of the catheter shape like a pig's tail. Wrap the nylon thread around the joint and lock the safety clip. Finally, fix the drainage catheter to the body surface. Seldinger puncture method. 1. Remove the inner needle, straighten the pig's tail with a guide tube and lock the outer needle tube onto the joint of the drainage tube. 2. After disinfecting the skin puncture site, lay a sterile towel on it. 3. After local anesthesia, make an incision with a scalpel. For ultrasound-guided puncture of the PTC needle into the target lesion and removal of the needle core. 5. The guide wire is inserted into the target lesion through the PTC needle. The direction and depth of the guide wire are observed and adjusted in real time by ultrasound to ensure that the tip of the guide wire reaches the target lesion as much as possible. 6. Withdraw the PTC needle. After the expansion tube expands the puncture point along the guide wire, insert the drainage catheter. After confirming that the end of the drainage catheter reaches the target position, withdraw the external needle tube and the guide wire. 7. Pull the nylon thread to make the front end of the catheter shape like a pig's tail. Wrap the nylon thread around the joint and lock the safety clip. Finally, fix the drainage catheter to the body surface. Contraindication. 1. Reuse is prohibited. 2. During the puncture, avoid the skull, cartilage and scar tissue to prevent damage to the tip of the catheter. 3. People who are allergic to the product material are prohibited from using it. Note: the product must comply with the relevant operation norms and regulations of the medical department. 2. Please operate this product in accordance with aseptic techniques to avoid contamination or infection. 3. Sterilized with ethylene oxide, for single use only, and destroyed after use. The packaging is damaged. Do not use. It is recommended that the maximum retention time of this product in the body be less than 30 days.